Hello, judges and investors. My name is Rasha and I'm the representative from MindEase. First, I want to ask you a question. Have you ever felt completely overwhelmed by stress, anxiety, or even burnout? But when you go to the hospital, you have to wait a very long line. Or if you take the private option, it is way too expensive. Well, MindEase has the perfect solution for you. First of all, let's look at the problem. Now, looking at our current situation, the mental health space in our country faces three main challenges. First, there is a clear lack of awareness. A clear lack of awareness creates social stigma that stops people from seeking help. Second, we have a major shortage of professionals, which leave our healthcare worker being very overworked. Because of this, patients face a long waiting time. When someone finally decides to seek help, they often have to wait weeks or months to finally get treated. Next, we can also see the validation. We can see that the data supports this reality. Right now, around 1 million Malaysian citizens aged 15 and above, which is around 4.6% of the population, suffer from depression. This rate has increased significantly between 2019 and 2023. We are also seeing this affect younger age group. 1 in 6 children between 5 and 15-year-olds face mental health issues. Now, this data is something that we need to focus on. We can also see that looking closer at the youth, the depression rates are highest during school transition, affecting 7.9% of 16 years old and 7.6% of 19-year-olds. Overall, 1 in 3 Malaysians will experience a mental health issue at some point. However, study shows that using phone application can significantly reduce symptoms of depression. The need is there, and we are the digital tools that could help prevent that. Now, let's talk about the solution. This is why we built MindEase, a straightforward 4-step. Step 1 is the survey. Users take mental health screening directly in our app. Step 2 is analyzation. This system processes the result based on the survey. Then after that, we go to the action. The app will suggest the next step, whether it's a self-care tool, health tips, or even directly contacting a professional. Step 4 is consultation. If really needed, the user is connected directly into a specialist, and we make the process very fast and very clear. Next, let's talk about the beneficiary. As a social enterprise, our platform helps several groups. Our main users are students dealing with mental pressure, working adults facing stress and burnout, and anyone facing financial or physical barriers to mental health care. At the same time, we partner with psychiatrists, clinics, pharmacies, healthcare institutions, and also government agencies. We do this to help them reach patients more efficiently. Next, we're going to talk about the target impact. With 1 in 3 Malaysians facing these issues, our target impact is practical. MindEase wants to reduce untreated mental health cases and improve access to support them. By offering digital screening, we can shorten the waiting time to get professional help, and our long-term goal is to increase mental health awareness, reduce the stigma, and also encourage people to seek help before things got very worse. Now, to reach students, working adult, and general public, we focus on these 3 strategies. The first one is digital awareness campaign. We will use TikTok videos, Instagram posters, and also YouTube educational content to go to the younger audience and give them the knowledge about mental health. The awareness is going to make them become our main beneficiary. Our second strategy is strategic partnership. We're going to work with university, hospital, NGOs, or even government agencies so that we can have a direct connection to them and give them the support that they needed. The third strategy is community engagement. We're going to run a local awareness program an early intervention initiative to connect with people directly, especially those in the rural areas. We're going to talk about the potential market size. The market size for MindEase is quite large. We have over 1.6 million students currently in Malaysian high school and colleges. For our B2B corporate program, we are targeting a pool of over 15 million active workers. Finally, official data shows that 1 million residents currently suffering from depression really needs our support. So the demand is very clear. Now, what makes our company different from another company is the fact that we offer free screening, mood tracking, and a 24/7 digital monitoring. We give professional referrals based strictly on clinical need. We also have a premium subscription which start at 39.99 ringgit a year for a specific courses like dealing with panic attacks or stress eating. Most importantly, we are a social enterprise, which means we reinvest our profits back into the community program. Now, let's look at our competitor. Our competitors are traditional services who provide specialist referrals but lack the easy digital access that we have. Standard mental health apps offer digital tools but usually do not partner with hospital or government agencies, and they don't operate as social enterprise. MindEase is the only platform that offers all of these features together. Now, our business model is designed to be self-sustaining. We make money through specialist referral commissions, insurance partnership, and health product advertising. Here's how we create social impact. All of our revenue is reinvested into offering free services to those who cannot afford them, funding awareness campaign, running community program, and also updating our platform when it's needed. Our now estimated revenues, if you look at it here, our largest source of income is corporate clients, which is around 40%. Our premium subscription makes up 26.7%, one-time consultation bring in around 20%, and medicine sales make up the final 13.3%. Having multiple revenue streams keep our business stable and long-lasting. Now, we have a clear three-phase plan. In phase 1, we will build and test our app. We will hire 3 full-time clinical psychologists, run social media campaigns, and aim for our first 500 active users. That is our first phase that we are going to do. In phase 2, we will launch the premium subscription, partner with universities like UUM, UM, and UITM. We also will collaborate with the B2B corporate clients, which is around 12 clients that we are targeting, and reach around 2,500 active users to break even. In phase 3, we will add an AI screening system and expand into suburban areas. We're also going to move our marketplace model with external psychologists on a 70-30 split, targeting over 10,000 users. Now, to build this platform and run it for 1 year, we need 400,000 ringgit. We have broken the budget down very clearly. 55.6% goes to the salaries of our core clinical professional. 21% goes to our marketing on platforms like Instagram, YouTube, and TikTok. 13.6% is for our platform engineering to keep and maintain our website. And also 9.9% is for the maintenance. For our financing structure, we plan to secure 62.5% from private investor like you, sir, and also 37.5% through government grants. Now, our ask is very clear. We ask for 250,000 ringgit for you to invest in our social enterprise. So, what is your call?